Hello, everyone. I really appreciate you joining this webinar today. It's towards the end of 2020, and we really want to spend a little bit of time talking to you about the rest of this year and really getting ready for 2021. I know it's a tough time at this part of the year for a lot of practices, but I think that if you spend a little bit of time listening to this and watching this webinar, you'll find that there's some solutions that can help you streamline your practice, even now, and especially for 2021. My name is Keith Washington. I'm the VP of Products here at ProSites, and most of the things that I talk about today are solutions that we can offer you and really want to help you as you continue to re-engage your practice and show you how you can use digital tools to improve and grow your practice. Just a couple of notes. This webinar is recorded, so if you are listening or attending this webinar, you'll be able to get a copy of the recording so you don't have to take notes. If you have any questions, please ask them in the questions panel, and our team will be taking a look at them and hopefully answering them for you live, or we'll reach out to you separately. And lastly, we usually have a brief survey for the webinar at the end of the webinar, so don't hesitate to answer those questions in the survey. We're really always looking for ways to improve in our webinars and our communications with our customers and with all of our partners in the dental practice. I show this slide from time to time because I get this from the American Dental Association and can just see the impact of the coronavirus on dental practices. And this is a question that they've been asking since March, the ADA survey that they send out and get a lot of responses. And if you can see that only about 33% of practices as of the middle of November were open in business as usual. Most practices are open but have a lower patient volume. Some of them have closed, and you guys know all of the story about what's going on in the dental practice and some of the challenges you have gone through, and really should just take a moment to think about the past 6 months and how you've overcome so many challenges starting in March and April and May, and when you reopened in May or June. And just all of the things that you've gone through and the things that you've learned and the changes that you've made in your practice. And I hope that you'll just really just take a moment and say, wow, we're doing better than we thought. However, we're in another pandemic wave, as most of you know, and you're changing how you're engaging with your patients, how you run your practice. You're continuing to adjust to your staff requirements for staff protocols and patient requirements. Of course, you're adjusting, most of you, to financial issues, and your patients are still asking questions about the process of getting good dental care, and it's important for patients to get dental care because without that, there are long-term health detriments to not having regular checkups and taking care of dental problems. In fact, a lot of you in practice are seeing more emergency situations as patients have delayed or deferred regular treatment or recommended treatment, and really finding ways to adjust your processes to make sure that you can have high quality care. I think by now you and anyone in practice know that you have to streamline your operation to get more patients through the practice. I remember at the beginning, most practices were only able to see about 40% of the patients as you adjusted to cleaning regimens and protocols and screening and testing and post-operatory requirements. But you're starting to get a cadence, and that the best way to really grow your practice, because in some cases you may have more patients than you can handle, the best way is to streamline your operations or automate a lot of your operations. Things like making sure that you get real-time information from patients about their COVID situation. Getting them using touchless onboarding and offboarding and automation of a lot of tasks. It used to be, a lot of paper exchanged hands and a lot of phone calls were made, and the ability to automate that, helps speed the process, and really using digital solutions to communicate and engage patients. I talk about this from time to time, both internally and with practices, about the new dental patient journey, and I really think of them as 3 different steps. The pre-visit, what happens from the time the patient is interested in making an appointment up to the day of the appointment itself, of course, and everything that they have to and you have to think about from the time they arrive to the time that they leave, and then of course the post visit. And all of these activities require an understatement, an understanding of what has to happen. First of all, a patient has to understand the safety protocol, what's required of them. If they're thinking about coming to your office, they need to discover, are you available? What procedures are you doing? I have to potentially book an appointment, and to be able to do that in an efficient way, I need to complete patient forms. All of this, leading up to up to the visit. When I get there, of course, I'm going to need to confirm the appointment, answer the pre-visit COVID questionnaires, announce that I'm coming into the building or into your practice. Then I have to get treatment and understand my treatment options. And as I talked about, there's too often, or more often than not now, the treatment isn't just a simple cleaning. You're finding, some other things that need to be taken care of. And once I do all of that, I need to pay my bill and follow up for treatment or get follow-up treatment. And all of these can be helped by having digital solutions to automate the journey. And I'm going to spend some time talking about these. I won't go through them in detail now, but the point being is that you can use digital tools to help your practice be more efficient and more effective. And if you're already doing some of it, you should be already seeing that benefit. If you're not, I just want to encourage you that digital solutions throughout that patient journey can really help in a number of different ways. First of all, the most important thing is you want to reduce talk time with patients. Even though you want to spend time talking to them when they're in the office, back and forth questions about my insurance, about what type of procedures you offer, what about your safety protocols. You don't want to have your staff just on the phone all day long trying to deal with, I need to postpone my appointment, or you need to postpone their appointment. You want to automatically inform patients of your safety protocols, and you want to make sure they know that clearly. You want to make sure you get critical care information from your patient, like their insurance, like their history, patient information, health history, the COVID questionnaire. You want to have them schedule appointments without having to call you 5 times and say, well, what about Thursday at 3? Well, maybe 3:30. You really want to streamline that process, not just for you, but for them as well. And as I talked about, communicating treatment plans. And by the way, one of the most important things is getting payment from patients without having to send them manual bills. And there are so many things that we can do. And we've actually talked about this really for the past 20 years about going paperless and automating. Now is the time to do that, to automate your communication, automate your onboarding, automate everything about your practice. Let's just talk about the communication. As you know, regular communication is more important than ever. And being able to do that, to keep your patients informed, reminding your patients about their oral health. A lot of people still haven't scheduled their appointments, even though it's benefit season, benefit reminder season. And the best way to do that is to automate these communications, to streamline everything about it. So you should be using an appointment reminder system or appointment communication system. It's got to be automated so that you can reduce any time you are spending on creating and managing the communications. It better be comprehensive and tied to the active patients in your system, and includes things like text, emails, phone calls, postcards, being able to reach patients in the way that they want to be communicated with. So I just want to stress enough. I think many people are using an automated communication system, and there are a lot of them out of there, but you want to make sure that it not just doesn't just do patient reminders, but also has the ability to reach out to patients with referrals and confirmations and provide you with the level of insights you need to make sure that you're getting all of the hygiene patients that you have. There are a lot of different systems that provide just recall or recare communication, but are you able to send out campaigns towards the end of the year automatically to tell patients, click here to schedule your appointment now? You really want to have that ecosystem in your solution. So I just would like to encourage you to build a timeline of communication for this next year. Start to build up your automated email campaigns over the next 3 weeks. January is really important too because now my flexible spending account renews, and so I may have used all my FSA money in 2020, and I may have some more in the next year. So really think about scheduling those communication campaigns so that you kick off 2021 in the most positive way. Get that calendar filled for January and February. Have all your recare campaigns ready. Make sure that your PPE protocol is in those communications. Also, always let your patients know about your scheduling priorities. I'm sure they have changed over time. You may be blocking out more time and space for emergency dental care because you have more emergencies. So make sure that you can communicate that in your emails and other ways. One thing you can consider is using postcards to make sure that you have a personal touch for your active patients, just to remind them, especially those who haven't been back since 2019, just to remind them that we're here for you and we're, ready to make sure we take care of you. Um, there's a couple of examples that we've shown over the past few months of automated communications. I think the key is making sure that you know that you have a system where you can easily tweak those communications based on what's going on now in your practice, because it's been fluid, as you know, in terms of what is important for your practice and what you want to communicate. Here's one that I really think has been powerful, that the current environment may have affected dental insurance for many people. And so if your insurance status has changed or if your plan has changed, to call us. And one of the reasons you want to do that is many people may not have insurance, but you may have a program where you can help them. You may have the ability through Care Credit or some other loan program to help them take care of their care. Too many potential patients aren't doing anything because they don't know what you offer. And so if you reach out to them, again, in an automated way, rather than have someone calling and hoping someone answers the phone, but you can send out text messages or postcards or emails to let them know we're here for you. One of the most powerful solutions, as you know, over the past few months is social media. And when I say that, I mean Facebook. So many people are on Facebook. You'd be surprised at the number of people who are engaged in Facebook and buying things on Facebook. I just bought something for my dental hygiene on Facebook just a few minutes ago. You really want to use it for real-time proactive communications. Make sure that your Facebook page has current updates and your Google My Business page has updates about your office hours, updates on any type of dental care you have, about your staff, making sure that they know that your practice is open. Keep reminding people. It's almost a requirement to remind people about the need for dental care. Here's an example, a couple of them. Some of them are kind of cute, but just a reminder that we're open, and we're open for orthodontic treatments is one of them. And thank you for being a patient. On the other side is we're open, pleased to announce that this was when they were back up and running. But you may see that this is an opportunity to regularly communicate the status of your practice. You also may want to send out postcards just to say, we're ready to see you. Call for your appointment today, or email us for your appointment today. One of the things that you already have done, but we talk about this from time to time, is make sure, especially with insurance issues, that you're reviewing all of the pricing options for your elective procedures. Make sure you determine if you're going to offer discounts for fee-for-service patients. Really make sure that you know and you communicate what's important for your practice, and make sure that your website and social media are updated with your key procedures. What is it that you think is going to be most effective? Is it cosmetic dental care right now? Is it we're just going to make sure that we take care of cleanings for as many people as we can, or we want to do emergency dental? Make sure that you're focused on those items and you're transparent about their process and options for being able to use these solutions. One of the things you want to do is think about your onboarding process. And I think, if we think about that journey, if you look at the tools for your onboarding and checkout process, I'm hoping and seeing so many people using online forums. And I really encourage you to use online forums because you an opportunity not just to see check boxes about patient information, but really gives you the opportunity with your online forums to have your COVID questionnaire right in those online forums. It also gives you critical care information. Do I have a history of diabetes? Am I experiencing some problems now? Because more people are experiencing problems than they were before. And so you want to be able to get those procedures for you and your patients in front of them and then incorporate that into your check-in process. You want to make sure that, for instance, all of your forms are filled out before they show up. No more time and no more expectation or desire to fill out a clipboard of questions while I'm sitting in an office. That causes stress for the patient and delay for you. You also want to have live chat, potentially. Consider that for questions from patients so that your front office can answer multiple questions at the same time. And of course, we'll talk about it maybe a little bit more, online bill pay. So there's systems like ours that allow you to send a text message when the procedure or when your visit is complete, and allow them to click to pay their bill, whether they're in your office right then or even when they go home, rather than you swiping a credit card and wiping a credit card and touching a credit card and sending them a receipt or handing them a receipt. You can do touchless bill pay right from your phone, right from their laptop, all connected to your website. Here's an example of one of the coronavirus questionnaires. One of the things we're really proud of is medical alerts and drug alerts that are part of our online forums, so that your front office, your team, your doctor is seeing dental alerts, drug alerts, and medical alerts real time, and you can even have them on the iPad for the particular doctor or hygienist to see before they even come into your office. As you know, ProSites is a website, digital marketing, patient engagement solution, and we've really seen practices that are the most successful in keeping their website up to date have the best experience with their patients. Make sure that your marketing message for 2021 is clear, given all that you know. Make sure that the communication that you're doing for your patients is very clear. Make sure your PPE protocol page is updated. Make sure your website is upgraded and customized and secure, and maybe even consider adjusting your images. It's not just about smiles, but it's about safe smiles, and it's about being able to know that your practice is really COVID focused or safety focused. Here's an example of a COVID page that we have for our practices, and I provided for them in the past, and we can update that, and we do that for our patients. We usually have been using a banner, especially now as you may have to change a little bit. I'm glad that dentists and dental practices are considered to be essential services for most states now, so you don't have to worry about opening and closing, but communication is really important. One of the things that we've seen over the past year is a much higher demand for online booking, online appointment booking, and giving patients a way to schedule appointments. Because we're working at home, or because we have a number of different requirements, or because we can only make decisions, it seems, on scheduling on the weekend, you want to make it easy for a patient to schedule an appointment, but you want to be able to control your own calendar. So the systems that you want to look at and what we provide is the ability for a patient to access a calendar that you control right from your website, and then they can choose a provider, they can request a time that works, and then you approve that time. And the reason why that's important is because if I schedule an appointment on your calendar for Tuesday at 9 a.m. and it turns out that you have 3 emergency procedures, and you know that on Monday, you want to be able to let me know that immediately. So you get to accept the appointment, and then that appointment gets sent into your practice management system. But it also provides much more ability for a patient to book an appointment and not have to worry about calling or talking to someone on off hours, or listening to an answering service who said they'll get back to you, or leaving in a voicemail. Now I have some confirmation that my appointment request is being considered. We all know how important teledentistry is and consultations are in the past number of months, and I'm glad to see that it's taking off. And this helps you diversify how you see and what ways that you see patients. As many of you know, it provides you with another option to deal with needs and resolutions without visiting the office. And here is the use case that I like to think about. There are some people who think that they may want cosmetic dentistry or they may want some type of treatment, but they want to schedule an appointment. You have them come into your office, you take up the 30 minutes, you make a recommendation of treatment, and they say that they're going to have to think about it. What if you could streamline this as well as find a way to get paid for providing your recommendations all through teledentistry? So we have solutions, and a lot of, some other companies have solutions that allow you to confer with your patients on your schedule rather than you setting up a consultation or you having to wait for live video. Now you can have them send in a video, you can respond with your own video, and it saves your practice time and money. It also allows you to triage emergency cases. Really important. So if I have a problem on Sunday night, I can send you, some screenshots or some video, and then you can triage that case when you come into the office or before you come into the office. Probably the most important thing as we look into 2021 is a way to generate cosmetic leads. If you can have a consultation and automate your cosmetic leads, this is a really powerful way to use digital technology to show a patient, here's what we can do for you. It's a really powerful solution, and we think that you can use teledentistry to really explain to them, here's what I think I can do for you. Joe, I see that you have this problem, in your teeth. This is what I'm going to do for you. I really, think you should come in. Please go on our website and book an appointment and make sure you know that you've already had a teledentistry consult with me. We offer a solution called Your Virtual Consult, which really reduces in-office time for the patient. It provides an option for you to review patient needs before they come in. And ultimately, we have shown that it increases case acceptance. That's another digital solution that you can use. Here is another different one called a dental case presenter. One thing I talked about is you're going to take up time in your chair, and too often patients say when you provide recommended treatment, you show them the quote unquote treatment plan, which I call a bill, and they say, I'll have to think about it. And they have to think about it because they're not sure about cost. They're not sure if they need the treatment. They're not sure about how invasive it is. And all of the things that swirl in the mind of we patients when we're sitting in a dental chair. You can use a dental case presenter to increase case acceptance rates. We have shown, and the industry has shown, about 60 to 70% of recommended treatment plans are accepted. That means 30 to 40% of recommended treatment plans is not accepted. So what if you have a way from a digital system to be able to explain the benefits, the alternatives, the cost, and not just here's the bill, here's what I recommend. Sometimes some practices aren't as good at being able to recommend dental treatment. We've provided an easy to use interface so you can select the treatment information that's being recommended. You can easily put in slideshows. You can swap in a video that shows what the recommended treatment is. You can bring in the treatment plan. You can give them multiple options for treatment and then send that presentation to them in their portal, or you can even show it to them right in their office and increase case acceptance rates with a customized presentation for each patient. Imagine if you can say, here's my recommended treatment. I'm going to send you a digital presentation, and all you have to do is book an appointment. You can even get the consent forms done electronically right then while they're in the chair, or they can look at it on the iPad or some device that you have. You can even put it up on the screen in the lab that you're using or in the operatory that you're using, so that you can help not just say, I recommend it, but increase patient acceptance and reduce their stress. For instance, you should talk about cost. It's going to cost about $2,000. It looks like your insurance is covering this amount. So it looks like your out-of-pocket costs will be $500. We have a payment plan. We offer payment loans through this particular vendor. You can show all of that so simply in a 10 to 12 page slide that's customized, and it takes you about 5 minutes to build that presentation. I really think that over time, this is going to be between this and our teledentistry options is going to be the way that practice is engaged with the patient. Most of the time, your work is done on actual treatment, but you're wasting a lot of time in onboarding, dealing with trying to convince the patient to get treatment, and then paying the bill. So if you think about the solutions that you could apply, your website, online appointment booking, of course, patient communication software that includes online patient forms, using texting that's built in a good patient reminder system, live chat, of course, dental teledentistry and case presentation. If you really think about the ways that you can incorporate online bill pay and follow-up communications, you can use digital solutions to really help you streamline your practice and make it more efficient in 2021. I really want to encourage you to take the time over the next couple of weeks to say, let me look at the tool set that I have. Let me look at our operation and how can we improve it? It really only takes a few minutes, and we can help. ProSites provides these solutions. We are the leading provider of digital solutions for helping our practices acquire, engage, and retain their patients. And we really think that at this time especially, we can help. We have great solutions and really good pricing options because we know that sometimes, it's tough time for practices as well. So please don't hesitate to reach out to us. We think that we can provide some solutions that really help you grow and improve your practice for 2021. I really wish you a really great rest of this year. I know that we're going to come out of this stronger than ever before, and I appreciate you taking the time. Just remember that if you have questions, just put them in the questions box. I really appreciate everyone joining this presentation and look forward to talking to you and meeting with you soon. Thank you.